Employees of healthcare facilities are 5 times more likely to experience workplace violence at some point in their careers than employees of almost any other industry. Another industry that has an elevated risk is the social services industry. Your healthcare organizations are providing both life and death treatment, but as well as treatment that may not be life and death, but that if done incorrectly, or in some cases you could do everything right and there is still a lifelong impact because of that ailment. And on the social services side, the life and death element may not exist, but life security does. Many social services organizations are providing a service like financial assistance, housing assistance, or job placement assistance, among many other things that fall under the social services umbrella. The clients and patients of healthcare and social services organizations rely on your organization to provide them with the care or the service that they need. And with that reliance comes an elevated expectation on the service or treatment that they receive. And when elevated expectations are not met, emotional responses come into play. Emotional responses are usually not based in logic or reason, and rarely are the implications of one's actions considered prior to acting out on an emotional response. This is why it is critical for organizations to have a crisis preparedness, a crisis response, and a crisis management plan in place that addresses as many different types of crisis as possible, including workplace violence. I know that many both healthcare facilities and social services organizations that are licensed by the Department of Health and Welfare or receive federal funding or have an accreditation may be required to have a crisis management plan in place. But in my experience anyway, when I've reviewed these plans for some of my clients that put the plan in place merely to comply with a requirement instead of to completely integrate it into their workplace culture, those plans fall short. If we're just checking boxes on forms to maintain a license or maintain an accreditation or continue to receive public funding, they rarely get from the top down and communicated and trained to all the employees within the organization. They also leave out key elements of crisis preparedness or crisis management. This is especially dangerous because most commercial insurance policies do not address workplace violence specifically. A commercial general liability policy may provide some coverage for clients, patients, or members of the general public who are victims of one of these incidents, but coverage will almost certainly need to be triggered by a lawsuit alleging any number of things, but commonly that it was the workplace culture or the facility's culture that contributed to or caused this act of violence, or just a lack of security. And on the workers' compensation side, where you would think employees are covered, you would be right in some sense, but wrong in others. An employee who has a physical injury will have treatment for that physical injury paid for by workers' compensation. And if they're forced to miss time due to the physical injury, they will also have their the pay they would be out reimbursed by the workers' compensation carrier. But mental health impacts like trauma or grief are not addressed in the vast majority of workers' compensation policies. And it's going to depend on the state your organization operates in as well, whether or not the state has mandated any sort of mental health treatment after something like this happens. But in almost all cases, an employee who is not physically injured has no coverage whatsoever for their mental health needs and will not be compensated for any time they missed if they just cannot bring themselves to go to work after watching their patients, their clients, or even their coworkers get injured or killed. At WaFd Insurance Group, we try to have these conversations with all of our clients so that we can help them develop and implement the crisis preparedness, crisis management, and crisis response plans. These plans should not be a placeholder so that we can go to the carrier and say, yes, you have this plan in place. It can help, but if we have documentation that shows that your employees are regularly being trained on these plans and that these plans are regularly being reviewed and adapted to current needs and emerging risks, that is going to make all the difference, both when it comes to preventing these acts of violence or managing them as efficiently as possible, but also when we're going to insurance carriers to negotiate rates on your behalf. If you're concerned that your crisis management plan does not address emerging risks or is not as adequate as it could be, feel free to reach out to me. Like I said, this is a conversation I've been having with the vast majority of my clients recently. Some of them are very open to working with me on developing and implementing these plans, and others aren't. It just may not be a fit or as plausible for their organization, and that's okay too. But from my experience anyway, even having these conversations can trigger responses or create new policies and procedures that weren't there previously that can make a big impact if they are ever needed.